Dr. Mathur, you can start your presentation.
Good morning to all. I will be presenting on evaluation of prognosis of chalazion with triamcinolone acetonide injection compared with incision and curettage. Chalazion is a chronic non-infective glycogranulomatous inflammation of the bone gland. When the viscosity of the secreted lipids and proteins medium increases with age, hormonal disorders or environmental factors, medium accumulates in the gland's duct. This plugging of gland leads to swelling. When this swelling becomes persistent in nature, it is termed as chalazion. There are a variety of options for the treatment of chalazion, including incision and curettage, carbon dioxide laser, intralesional steroid injection, botulinum neurotoxin type A injection, and thermal cautery or total excision. Most widely accepted techniques are incision and curettage and intralesional steroid treatment. Aim to compare the effectiveness of intralesional triamcinolone acetonide versus incision and curettage in the treatment of chalazion. My objective is to compare resolution of chalazion with intralesional injection of triamcinolone versus incision and curettage. Material and methods. Randomized controlled trial, we took 60 patients with chalazion. Chalazion measuring up to 2 mm to 7 mm in size was taken. Two study groups were made, one with triamcinolone acetonide, which included 30 patients, and other with incision and curettage, which included 30 patients. Both groups were further divided depending on size of the lesion, with 2 to 4 mm with 15 patients and more than 4 mm 15 patients. In triamcinolone acetonide injection of 0.1 to 0.2 ml of triamcinolone 40 mg per ml solution through conjunctiva is given. 26 gauge 1 cc tuberculin syringe is used. It has the advantage when treating children, patients having local or systemic allergic reactions to anesthesia, as well when having chalazion closer to the lacrimal drainage system. In incision and curettage, topical paracaine was added to the eye. 1 to 1.5 ml of lignocaine with 1 to 1 lakh epinephrine is injected beneath the orbicularis muscle through the skin root over the chalazion site. A chalazion clamp is inserted so that its circular opening surrounds the conjunctival aspect of the chalazion while its blade lies against the skin surface. Number 11 Bart-Parker blade is used to incise the tarsus vertically up to 3 mm over the area of chalazion. The curate is used to scrape out the cyst, tarsus and orbicularis surface until the entire content and wall of the cyst is removed from the internal lid. This is the procedure. Result. Patients were equally distributed with respect to size of the lesion in both the groups. Each group had 15 patients between 2 to 4 mm, while other 15 had size more than 4 mm. Of total 60 patients, complete resolution was observed in 91.7% patients, of which 90% were of group 1, while 93.3% were of group 2. It was observed that overall patients who underwent incision and curettage showed slightly better results than who were given intralesional triamcinolone acetonide injection. We observed that resolution rate in small lesion was better in patients who were given triamcinolone acetonide injection, while patients who had size more than 4 mm, resolution rate was better with incision and curettage. Discussion. In present study, we found that the lesion less than 4 mm respond well to triamcinolone acetonide injection than INC, while lesions which are more than 4 mm have better outcome with INC. This study supports previous studies and showed that triamcinolone injection may be a good alternative to incision and curettage in primary chalazion when diagnosis is straightforward and no biopsy is required. Treatment by injection is simpler and less inconvenient to patients, although the eyelid injection may be somewhat painful. The result of the present study were in accordance with the study conducted by Simon et al. And Goala and Associate. It was in contrast with the study conducted by Jacobs, who showed that higher cure rate by incision and curettage had a statistical significance value. Conclusion. From this study, we concluded that size less than 4 mm, we prefer intralesional injection, and size more than 4 mm, we preferred incision and curettage. These are the references. Thank you.
So, is this about only single injection or you have given multiple also?
Single injection.
Only single. So you didn't use in those that didn't resolve with single injection?
No, so that was a weakness we didn't use.
Right.
And how long did you wait for the chalazion to resolve before you could switch it to the incision? All of them resolved? in your study?
90% of them resolved.
And how long did you wait? How time?
So
How much time did it take?
we waited for